complication during the extraction. Now speak about the complication occur after extraction. يعني patient go home or this complication occur after 2 or 3 days after extraction. First, trismus. What is trismus? Trismus means that limitation of mouth opening. Limitation of mouth opening occur after extraction of lower wisdom tooth. Trismus means that limitation of mouth opening occurs after extraction of lower wisdom tooth. This is trismus. Due to what? Due to the muscle spasm, يعني contraction of the muscle of mastication. And muscle spasm means that muscle of mastication, especially medial pterygoid muscle in lateral side of the ramus. Causes of trismus. First, multiple injection to medial pterygoid muscle. This is medial pterygoid muscle. Multiple injection during give anesthesia for extraction of lower wisdom tooth. Mean that block technique. Sometimes you give the patient one injection, the anesthesia became failure, and you try to give the patient multiple injection to medial pterygoid muscle. This is medial pterygoid muscle in medial side of the ramus. The origin of this muscle from the medial surface of lateral pterygoid plate to medial surface of the ramus. This is medial pterygoid muscle. When you give multiple injection for this muscle, lead to trismus. This is one of the reasons of the trismus. The second reason, trauma of the surgical field, and trauma to the surgical field, especially difficult lengthy surgical procedure. يعني procedure of the extraction remain for 1 hour. يعني 1 hour you try to extraction of the lower wisdom tooth, lengthy of the surgical procedure. And other causes, inflammatory of the post-extraction wound. The extract area became infected, or hematoma and post-operative edema. Hematoma means that collection of the blood. Collection of the blood. Hem يعني blood. Edema, fluid collection, and collection of the fluid. And causes of the trismus, we have 3 causes. First, injury to the medial pterygoid muscle. Injury to the medial pterygoid muscle. Second, trauma to the surgical field. Third, inflammation of the post-extraction wound, or hematoma or post-operative edema, lead to limitation of mouth opening. This is muscle of mastication. First, temporalis muscle. From the temporal region, this is origin of the temporalis muscle, to coronoid process. This is coronoid process. The origin of the temporalis muscle from the temporal bone and insertion to coronoid process. This is masseter muscle. The origin of the masseter muscle of zygomatic arch. Zygomatic arch. And insert to lateral surface of the ramus. Lateral surface of the ramus. Medial pterygoid. Origin of the medial pterygoid from the pterygoid plate. From the medial surface of lateral pterygoid plate. And insert to medial surface of the ramus. And this is lateral pterygoid. Lateral pterygoid from the lateral surface of the pterygoid plate to condyle, to the neck of the condyle. treatment of the
دكتور يا سلايد يمك موجود ما دا يتحرك من البرزنتيشن.
هذا سلايد
سلايد الثاني الثالث
ثالث حبيبي
دكتور يمنا الثاني موجود بس
أول
لا الثاني موجود
هسه يا سلايد
هو الثاني بس ما دا يتحرك
هسه اكو حركة
هسه تمام
اي تمام هذا الثاني يعني أول واحد ما أحسب يعني ثاني واحد هسه
اي تمام تمام دكتور.
هسه أنا بس سويت شرح هذا ما موجود بس هذا توضيح سويت هذا يعني ما مطلوب بس لازم أنتم تعرفون muscle of mastication. هذا الشرح ما مطلوب بس muscle of mastication original insertion. What are the muscle of mastication? We have 4 muscle of mastication يعني masseter و medial pterygoid temporalis and lateral pterygoid. أنا خليت هذا الصورة حتى يصير توضيح أكثر يعني ما مطلوب عندنا. تمام حبيبي. treatment of the trismus heat therapy يعني hot compresses are placed extraorally for approximately 20 minutes every hour until symptoms subside. يعني first treatment heat therapy يعني نخليها خارجي على حد لمدة 20 دقيقة every hours and 20 minutes every hours or gentle massage of temporomandibular joint and administration of analgesia يعني to release the pain and antibiotic to prevent infection and muscle relaxant medication to relaxation of the muscle of mastication يعني administration of analgesia anti-inflammatory mean antibiotic and muscle relaxation. And the last one, and it is very important, physiotherapy. This is physiotherapy treatment for trismus. يعني put tongue depressor inside the patient's mouth and increase one by one and put by hammer or anything to go the tongue depressor inside the patient's mouth and lead to opening the patient. But this is slowly do this physiotherapy. يعني 3 to 5 minutes every 3-4 hours, which include movement of the opening and closing the mouth, increase the extent of the mouth opening. This is physiotherapy for the patient. Complaint from the trismus. And now, other complication, hematoma. This is hematoma. Blood accumulate inside the tissue without any escape from the closed wound or tightly sutured flap under the pressure. يعني hematoma means that collection of the blood. Depending on the operation, the hematoma may be submucosal, يعني between the mucosa, or subperiosteum, يعني between the periosteum, يعني cover the bone, between the periosteum and the bone, or intramuscular, يعني داخل العضلة, or facial hematoma. Treatment. If the hematoma is formed during the first few hours, management consists of placing cold pack extraorally during the first 24 hours. Then heat therapy to help it to subside more rapidly. Some people recommend it, and some scientists, not people, administration of antibiotic to avoid suppuration of hematoma and to avoid infection of the hematoma, and analgesia for pain relief. Hematoma يعني during the 24 hours, first 24 hours, and place the cold pack. After that, heat therapy to subside more rapidly. Some scientists recommended use antibiotic to avoid the infection and analgesia to relieve the pain. Analgesia to relieve the pain. This is hematoma. Hematoma, this is change of the color of the skin. A difference between hematoma and edema. This is edema. This is ecchymosis. Ecchymosis change color of the skin. Change color of the skin, which present as a friable capillaries and decreased tissue tone. It may be a result of damage during the flap retraction with various retractor. Sometimes during the flap retraction by the retractor lead to ecchymosis. Ecchymosis just change color of the skin due to the rupture or pressure on the capillaries, not blood vessels, large blood vessels. Hematoma most common of the collection of the blood due to rupture of the blood vessel, any artery or vein. In order to avoid this complication, retractor should be gently handled, and during the retraction, gently handled, especially in the region of the mental nerve. This is mental nerve. Zygomatico, this is zygomatic-alveolar crest. This is zygomatic bone, and this is alveolar bone, especially in this region. Zygomatic-alveolar crest. And canine eminence. This is central lateral canine. This is canine eminence in this region. This is canine eminence. And in order to avoid this complication, the retraction and retractor gently handled in this area, especially mental nerve. Zygomatico-alveolar crest, this area, and canine eminence. This is canine eminence. Treatment. No particular treatment is required. The patient should be informed that it is not a serious situation. Ecchymosis gradually subsided within few days, changing color in the process. And for the ecchymosis, no need for treatment, just need the time. With the time, the ecchymosis subsided. And this is edema. نعم حبيبي.
دكتور شو الفرق بينه وبين الهيماتوما بالضبط؟ واحد شلون يفرق بالعملي؟
بالعملي هيماتوما more darker, and due to the rupture of the vessel, rupture of the large blood vessel. But ecchymosis just superficial change of the skin. فهمت قصدي؟
نعم دكتور تمام.
just superficial change of the color of the skin. Superficial and small, not large. And this is edema. Edema, this complication secondary to soft tissue trauma, result of extravasation of the fluid by traumatized tissue because destruction or obstruction of the drainage of the lymph which accumulate in the tissue. extravasation of the fluid, edema. Edema just extravasation of the fluid due to what? Due to the obstruction or destruction of the lymph vessels. No change of the color of the skin. Edema swelling like hematoma, but hematoma change color of the skin, but edema not change color of the skin. See there? Just swelling. But in some cases, when the edema reach to this area below the infraorbital region, the skin change color. Swelling reach the maximum within the 48 or 72 hours after surgical procedure and began to subside on the third or fourth day post-operative. Edema يصل إلى قمة خلال 72 ساعة، وراها ينزل and became subsided. يعني after 24 hours the edema gradually became subsided. يعني this is very important to tell the patient after surgical procedure the hematoma increased from the first day, second day, third day, reached to the maximum swelling. After 3 days, the hematoma decreased gradually. Clinical sign: smooth, pale, taut skin. When swelling is due to the inflammation, this is important, the skin present with redness depending on the amount of the tissue in the area. The edema range from type of the edema: small, moderate, rarely severe. This is edema, and change color of the skin. Why? When surgical procedure performed in maxilla, the edema may extend as far the lower eyelid because tissue in this area, especially loose, or because the patient may have bleeding disorder. And in 2 cases, edema in the infraorbital region became redness due to the tissue in this area loose, or patient has systemic disease like blood disorder. This area became cyanotic, يعني bluish, this bluish in color. Treatment: small size edema not require any treatment. Small size edema not require any treatment. For preventive reason, cold pack should be applied locally immediately after surgery. يعني close cold packs extraorally, and should be placed for 10 or 15 minutes every half hours for 4 or 6 hours. يعني كل نصف ساعة لازم نخليها 10 ل 15 دقيقة، وهاي عملية لازم يستمر رأسا ورا سويت قلع جراحي لمدة 4 ل 6 ساعات. لازم يركزون على هاي النقطة. يعني 10 ل 15 دقيقة نخلي كولد باك، يعني ثلج أي شيء نخليها بداخل قطعة من القماش ونخليها خارجي. ونغيرها كل نصف ساعة. هاي عملية نستمر لمدة 4 ل 6 ساعات. When edema is severe, and especially if does not subside, it should be treated carefully because edema present for long period of the time lead to fibrosis, يعني تليف. Post-extraction granuloma. This is granulation tissue. This complication occurs after 4 or 5 days after extraction of the tooth, and result of the presence of the foreign body in the alveolus. Like foreign body, we have many things like foreign body: amalgam, remnant, bone chips, small tooth fragment, calculus. Foreign body in this area irritate the area, so the post-extraction healing cease, يعني stop عملية healing, and there is suppuration of the wound, يعني the wound became infected. يعني post-extraction granuloma occur after 4 or 5 days due to the presence of the foreign body. Foreign body like what? Like amalgam, bone chips, small tooth, or calculus. This complication is treated with debridement of the alveolus, يعني clean the area and remove every causative agent. يعني remove the foreign body in this area. Painful post-extraction socket. Painful post-extraction socket. This is socket, painful post-extraction. This complication occur immediately after anesthesia wear off. يعني after the anesthesia became removed. Mainly at the posterior extraction of mandibular third molar. Mandibular third molar and lower mandibular third molar. When the sharp, due to what? Sharp bony spicule are easily created in this area. Sharp, this is sharp bony spicule. The bone age injury, this bone age injury the soft tissue. Resulting in severe pain and inflammation of the side of the extraction. يعني post-extraction socket due to the presence of the sharp edge. This sharp edge irritate or injury the soft tissue. Injury the soft tissue. Management is very easy. Remove this sharp edge or cut it by, or smooth it by bone wronger or bone file. This treatment. This complication treated with smoothing of the bone margin. This is bone margin by bone wronger or bone file, and sometimes remove the intraradicular bone and give the patient analgesia. Sometimes goes put it in the socket for 63 or 48 hours. يعني لمدة 3 أيام نخليها. يعني just remove the sharp edge by bone file or bone wronger. This is sharp edge. And this complication after extraction became painful due to the presence of the sharp edge. This is bone wronger. Cut, remove the sharp edge by bone wronger. This is sharp. Fibrinolytic alveolitis. This is dry socket. This post-operative complication appear 2 or 3 days after extraction. During this period, the blood clot inside the socket disintegrated and dislodged, resulting in delay healing and necrosis of bone surface of the socket. يعني dry socket due to what? Due to the blood dislodged inside the socket. Blood dislodged inside the socket. This is dry socket means inflammation of the socket. This disturbance is thermally dry socket, characterized by what? Empty socket. And if you take the X-ray, there is no tooth or piece of the tooth remain in the socket. And empty of the socket. Fetid breath odor and bad taste in the mouth. Denuded bone wall and severe pain that radiated to other area of the head. Severe pain and radiated to other area of the head. Etiology and pathogenesis of the dry socket. Dense and sclerotic bone surrounding the tooth. Infection during or after extraction. Injury of the alveolus. Infiltration anesthesia. Why anesthesia? Vasoconstriction. The causes of the dry socket, dense bone, infection, injury of the alveolus, and infiltration anesthesia. The most important treatment of the dry socket. Gently irrigate the socket with warm saline solution. The socket irrigate by normal saline. Placing gauze impregnated with eugenol, and it means that Alvogel is placed approximately every 24 hours until the pain subsided. Put gauze may be used with remain inside alveolus for 5 days, or sometimes you put iodoform gauze or enzyme are placed locally. The pain gradually subsides and the patient is given instruction to avoid mastication on the affected side. This is important. Instruct the patient to avoid mastication in the affected side to prevent food go the socket on this side. This is Alvogel. Put it inside the socket. You can change every day or sometimes put it for 5 days, but it is better change every day this Alvogel. And the treatment of the dry socket, gently irrigate the socket with normal saline and put Alvogel, and give the patient instruction to avoid mastication, mean that eating on the affected side.
دكتور
نعم حبيبي.
يعني بالبدايه نخلي النورمال ساين وبعدين نخلي عليه الافيوجي.
نورمال بس ننظفها بالنورمال ساين، ما نخلي يعني تنظيف، تخليها بالتنظيف.
تمام.
والفوجيل كافي.
حتى تمام. حتى يمنع عن البليدنج.
من البليدنج. يعني نقول للمريض لا يصير مثلا اكل على هاي الجهه لمده اسبوع او اكثر، يعني لا يصير اكل على هاي الجهه. اهم شيء يعني 3 نقاط: تنظيف والفوجيل والاكل. تمام
دكتور، تمام يعني عاشتي لك.
زين دكتور، احنا قلنا كل يوم الافضل انه كل يوم نخليها للافيوجين.
الفوجيل.
تمام؟
الفوجيل.
اوكي. زين احنا نعطي هاي العلبه للمريض ويحطها انه هو كل يوم لازم يجي له.
باخوي عفوا المريض ما يعرف يسوي هاي الشغله، لازم يجي للعياده انت تشوفها. يعني تسوي تنظيف وتخليه الفوجيل، وتقدر تخليها لمده 5 أيام.
5 أيام تمام.
تمام. بس اهم شيء هاي كومبليكيشن يصير هوايه يعني. تمام. Any question? Now wound, infection of the wound. Infection of the is other complication that may present and spread not only to the superficial surgical wound, but sometimes go to the depth and extent of the tissue involving the surgical manipulation. Causes of the wound infection: use of the infected instrument. And why you every instrument when you use it must be sterilized after that you reuse it. And must be sterilized. If not sterilized, the area became infected. And also disposable material also it is not cause wound infection. Disposable materials during the surgical procedure. And someone now ask me why disposable material, it is better use them, but not better use this disposable material. And it is better use sterilized material. يعني one of the causes of the wound infection, disposable materials. Aseptic substrate over the surgical procedure. يعني sometimes it is better هذا القطن أو الجوز لازم معقم. يعني septic substrate or defective bone substrate secondary to disease of the skeletal system, osteopetrosis, or radiotherapy of the jaw on facial area. Also, sometimes systemic disease lead to increased susceptibility to the infection like leukemia. يعني بالمختصر wound infection due to the unsterilized material or disposable material or disease of the bone or أخذ الإشعاع للمنطقة radiotherapy or systemic disease like leukemia. leukemia يعني سرطان الدم. leukemia سرطان الدم. leukemia. When the dentist deems that risk of the developing post-operative infection, you give him the prophylactic antibiotic or administration. Prophylactic antibiotic, what يعني mean that? Mean that this antibiotic give the patient before you do the procedure. يعني 1 hour before the procedure. And sometimes you try to extraction of lower wisdom teeth. You afraid the patient became infected. Before 1 hour you give antibiotic. This is mean that prophylactic antibiotic. يعني this antibiotic give to the patient 1 hour before the surgical procedure. If the wound already became infected, give antibiotic therapy should be administered depending on the case and depending on the type of the infection. And we have two types of them. To prevent the wound infection, prophylactic antibiotic. يعني antibiotic give the patient 1 hour before the surgical procedure. And sometimes the wound became already infected. What we do, give the antibiotic according to the infection, according to the case. Disturbance in post-operative wound healing. This is wound not healed. This is dehiscence. General factors which include blood diseases like leukemia and diabetes mellitus and local factors, local wound infection, infected the wound, inflammation, dry socket, irradiated region, يعني patient take radiotherapy for this region, benign and malignant tumors, wound damage caused by the instrument, like يعني the wound injured by the bear or elevators, flap dehiscence. This is dehiscence of the, this is edge of the flap and other edge of the flap. This is dehiscence, يعني open the wound due to that rupture of the suture, يعني not do good suture or very tight suture. Dehiscence of the flap. Dehiscence means that open the wound due to the rupture of the suture. Nerve injury. This complication became during the surgical procedure. This complication not post-operative complication. This is during the surgery, this complication occur. Is one of the serious complications that may occur during the oral surgical procedure. The most common nerve injury, inferior alveolar nerve, when you extraction of lower wisdom teeth. Mental nerve, when extraction of premolaris. Lingual nerve also during the extraction of lower wisdom teeth due to the retraction of the lingual flap and trauma to the lingual plate. Nerve trauma may cause sensory disturbance, anesthesia, hyperesthesia, paresthesia, dysesthesia in the innervated area. According to CDON classification of the nerve injury, we have 3 types of the nerve injury. Neuropraxia. Neuropraxia. This is neuropraxia. May occur after simple contact with the nerve. Nerve conduction, this is nerve conduction, is failure usually temporary and is completely recovery without permanent pathologic or anatomic defect. Recovery is quite rapid and occur gradually within few days or 2 weeks. And in neuropraxia, just you contact with the nerve. There is no any injury to the nerve. Just you contact the nerve. This lead to temporal paresthesia. This complication, no need for any treatment. Just few days or some weeks, the nerve return to original position. This is neuropraxia. Neuropraxia. The second one, axonotemesis. Axonotemesis. In this paragraph, we see the mental foramen on the crest of the ridge. When you do incision, lead to injury or cut of the mental nerve. You must carefully in this kind of the patient, and especially edentulous patient. This is mental nerve. On the crest of the bone. In this area, this is central lateral canine, and this is area of the mental foramen, يعني premolar area. Incorrect incision in this region, in the premolar area, resulting in injury to the mental nerve. يعني in this area you cannot do vertical incision like this. Lead to injury of the mental nerve in lower premolaris. يعني contraindication when you do the vertical incision. Vertical incision. Vertical incision. Axonotemesis, this is a serious injury of the nerve resulting in degeneration of the nerve axon. Degeneration of the nerve axon without anatomic surveillance of the endoneuron. Regeneration and recovery of sensation is slower than the neuropraxia and usually began as a paresthesia for 6 to 8 weeks after injury. This is axonotemesis. This is axonotemesis. يعني the axon is cut the axon. In the neuropraxia, axon is normal, just contact to the nerve. In the axonotemesis, axon is cut. Neurotemesis completely cut the nerve. Completely cut the nerve. In this condition, need nerve repair. And you make the nerve between them and suture in this side and other side. And this kind if the nerve is cut, it never return to original position. If the nerve is cut. Result in discontinuation of the conduction of surveillance of the nerve or due to the formation of the scar tissue at the area of the trauma. Neurotemesis may be produced by trauma of the nerve branch due to the traction. Ischemia يعني decrease the oxygen due to the prolonged compression. Tearing of the nerve. This kind of the injury may cause permanent damage to the nerve function, including paresthesia or anesthesia and permanent damage to the nerve. Neuromesis. Etiology. First, injury of the nerve of the following cases lead to. During administration of the nerve block. When you sometimes you injury to the inferior alveolar nerve by the needle touch. By the needle. While creating the incision that extend to the region of the mental nerve. This is sometimes you do incision on the crest, the mental nerve on the crest already. You do incision lead to injury of the inferior mental nerve. Sometimes due to the lingual retraction, injury to the lingual nerve. During the excessive flap retraction, this is mental and this is retraction of this area. Compression with the retractor during the retraction in the region of the mental nerve or at the lingual side. Lingual region of the third molar. When bone near the nerve in this area excessively heated, if bare of the surgical handpiece is not irrigated with a saline solution, and never use the surgical handpiece without normal saline, without irrigation, lead to burning and heat, go to the inside the bone and pressure on the nerve. In case of removal of the wisdom tooth or root deep in the bone, are close to the mental nerve or inferior alveolar nerve. In case of the deep impaction, this is cause of injury to these two nerves, mental and inferior alveolar nerve. Sometimes when the bare, the surgical handpiece, enter to the mandibular canal. This is mandibular. During the sectioning of the lower wisdom teeth and crown of the lower wisdom teeth. Sometimes by surgical handpiece, when you try to section of the teeth, the surgical handpiece go inside the mandibular canal, lead to injury of the inferior alveolar nerve. Or during the fracture of the lingual cortical plate. In case of displacement of the root inside of the canal. This is root inside of the canal, lead to injury of the inferior alveolar nerve. Or sometimes when you try to extraction of this piece of the root, lead to injury of the inferior alveolar canal. And make the trauma to inferior alveolar canal. Trauma to inferior alveolar canal. Treatment. No particular treatment is indicated for neuropraxia or axonotmesis. And in these two situations, no need for special treatment. If root tip or foreign body compress of the nerve like this, in such case it must be removed. And the paresthesia due to the pressure by the foreign body or piece of the root. In this condition, you should remove this piece. Injury to the nerve result of the neurotomesis must be treated as much as possible by graft and by nerve graft, replacing injured area segment or severe segment must be sutured. Just neurotomesis need for treatment by graft or suture and other distal and proximal end which each others by sutures. And thank you. You have any question or explanation?
دكتور
نعم.
دكتور بس عيد سلايد 37.
37 يعني قصدك هذا يعني وين the bear enter 37 قصد عفوا
دكتور اللي بعد هاي السلايد.
هذا
اي صح هذا.
إيه. Neuropraxia and axonotemy no need for treatment. We have no specific treatment for this two type of the injury. Just neurotemesis يعني when you cut the nerve and completely cut the nerve need special treatment by nerve graft but not available here. يعني under microscope يعني need more facility. يعني one end of the nerve يعني we have two type يعني for neurotemesis for treatment. By graft يعني sometimes lingual nerve نخليها between them or nerve from the food. Take the nerve from the food and نخلي بيناتهم or by suture proximal and distal part of the nerve sutured. Neurotemesis. Just this kind need treatment and as much as possible must be treated. If not treated, the area that innervated by this nerve became paresthesia. يعني for example, if injured and cut the inferior alveolar nerve from the central to last molar, the teeth became anesthetized and loss of sensation. And mucosa from the mental region to central became anesthetized. مفهوم؟
تمام دكتور عاشت ايدك.
دكتور
نعم حبيبي.
عندي سؤال. بيا حالات بعد القلع يتخيط الجرح يعني خلينا نقول بس بالقلع الجراحي؟
بس قلع الجراحي. My idea بس قلع الجراحي. إذا socket already
يعني
open no need.
الوزن؟
إذا socket already open no need for suturing. You make incision need suture. يعني according your incision.
تمام.
مفهوم؟ According your incision. If you do incision need suture. If not do incision or not do tear the soft tissue no need for suture.
يعني السوكت مال السن يبقى عادي
عادي already healed.
تمام دكتور عاشتي دكتور.
Just use squeeze the socket by pressure.
دكتور بلازحنا سؤال.
نعم حبيبي.
حبوب البروفيلاكسيك قلت قبل ساعة لو كان البيشنت بها حالة نقدر نعطيها.
إذا تخاف أنت هذا المرض يصيب became infected يعني after extraction. بس علميا prophylactic just given in the following condition يعني patient with pulmonary valve diseases, infective endocarditis, pulmonary shunt. يعني اعتيادي احنا ما نعطيها هذا.
ماشي دكتور
بس يعني prophylactic is this حالات يعني.
ماشي.
This take in immunocompromised patient and need lecture about this prophylactic antibiotic.
شكرا دكتور.
أكو السؤال الثاني.
دكتور.
نعم حبيبي.
We need Alpha-Gel after difficult extraction, yeah or no?
No. Alpha-Gel just specially use it when tooth became dry socket. When tooth became dry socket. Full no. يعني patient go to home after 2 or 3 days came to you complaint from the pain. You see the socket is empty, clear, not piece of the tooth remain. Mean that dry socket. Just clean the area, wash by normal saline and put Alvogel. And especially in this condition, use the Alvogel. And routinely, no need for use the Alvogel.
Okay, doctor. Used for both child and adult?
If dry socket became, yes. But child, يعني very rare, يعني dry socket. Why? Because the permanent tooth below the extracted tooth. يعني I see the dry socket from the child. And just occur in the old age and especially in the wisdom tooth occurs. Posterior region due to the food impaction.
Yeah, doctor. During the suturing,
نعم.
Not used Alvogel and then suturing, yeah?
No need Alvogel. And it must be, the socket must be open.
Okay, doctor. Thanks.
And Alvogel put in the open socket. And never use the Alvogel and suture the socket. Because the socket became healed one after one day. أكو استفسار سؤال.
دكتور
نعم.
دكتور